Metformin is a medication commonly prescribed to manage type 2 diabetes. When taken correctly, metformin can effectively control your diabetes. You'll need to know: how and when should you take your metformin? How long does it take for the medication to work? How long will you need to take your medication for? And are there any side effects? Today we'll be answering the most frequent questions about your medication.
Maybe it's something in the water, or maybe we just hit the end of the road. Right now.
My name is Dr Hart-Pinto. At JHP Medical we make weekly information videos. If you like what you see here, why not subscribe and share this channel with your friends and family. So what is metformin? Metformin is a medication commonly prescribed for the management of type 2 diabetes. Before we can understand how this medication works for you, we need to understand what is type 2 diabetes. Type 2 diabetes is a condition of high blood sugars. Here, your body doesn't effectively respond to insulin, the natural hormone produced by your body to reduce blood sugar levels. Common symptoms include increased thirst, passing urine more frequently, and feeling tired all the time. If left uncontrolled, diabetes can lead to significant problems with your heart, blood vessels, eyes, kidneys, and nervous system. Metformin works by lowering your blood sugar. Firstly, it does this by reducing the number of sugars released into your bloodstream and increasing the effectiveness of the hormone insulin. Metformin can be used in adults and children above the age of 10 years. It's available in both liquid and oral forms and may be prescribed under any of the following commercial branded names: Glucophage, Bolamyn, Diagemet, Glucient, Metabet, and Riomet. Is there anyone who should not take metformin? It's best to speak with your doctor if you have any of the following conditions. You've previously suffered an allergic reaction to this type of medication, you suffer from a heart condition such as heart failure, or you have kidney disease. Increased caution is also required in older patients. Additionally, your doctor may ask you to temporarily stop your medication if you're currently suffering from an infection, you plan to have a scan requiring a special dye, and before surgical procedures, where you will be put to sleep. Is metformin safe in pregnancy and breastfeeding? Metformin is generally considered to be safe to use in pregnancy. So much so that it's recommended for a form of temporary diabetes of pregnancy some women can develop called gestational diabetes. In breastfeeding, a small amount of metformin is present in your breast milk. This is not thought to be harmful to baby in such small amounts. Is it safe to take metformin with my current medications? Metformin can interact with several medications, and your doctor may need to make appropriate adjustments to your existing medications to ensure they remain effective for you. The medications to look out for are other diabetic medications, steroids, and hormone treatments, including oral contraceptive pills. This is because contraceptive pills can affect your blood sugars, so if you take this medication, your doctor may need to adjust your existing diabetic medications. Heart medications, and those used for controlling blood pressure. Water tablets, which are those that make you pass more urine and control how much fluid your body holds onto, such as furosemide. What is the correct dose of metformin? Metformin comes in a wide variety of strengths. A common starting dosage is 500 mg taken once a day with your breakfast. Your healthcare professional will adjust your dosing to help you reach a healthy target for your blood sugars. This is usually guided by a blood test known as HbA1c. Metformin is also available in both immediate and slow release preparations. How long does it take for metformin to work? It can take about 1 to 2 weeks before your blood sugar control improves. After approximately 3 months, your doctor will repeat your blood tests to see how well metformin is working for you and consider at that time any need for dose adjustments. How to take metformin? It's advisable to take metformin with a meal. Usually, it's best to take with a large glass of water. Using this method, you can help limit side effects that patients may experience when taking this medication. The timing of your doses will be dependent on your dosing regime. Therefore, your prescribing doctor or pharmacist can advise you on your individual circumstances. Are there any foods I should avoid? As part of your ongoing diabetes care, you should limit your intake of sugary foods, particularly cakes, biscuits, fizzy drinks, and fruit juices. Doing this will ensure you get closer to your diabetic target and reduce your risk of long-term complications associated with poor diabetic control. Can I drink alcohol with this medication? It's safe to take alcohol with metformin, however, excess alcohol in combination with metformin can lead to your blood sugars becoming too low. Therefore, please drink sensibly when taking this medication. I've missed my dose, what should I do? If you forget to take your metformin, don't worry. Take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose. Remember to take your next dose at the regular time. Do not double dose to make up for a missed one. I've accidentally taken too much medication. If you've taken too much of this medication, you should speak with an emergency doctor. If you take too much, it can cause a buildup of acid, lactic acid, in your blood, which in severe cases can be life-threatening. Overdose of metformin can cause symptoms of stomach pains, decreased appetite and diarrhea, the sensation of being very cold, tiredness, sleepiness or weakness, change in your breathing pattern, or even muscle cramping. How long will I need to take my medication? You'll most likely remain on metformin for the long term. Most patients with type 2 diabetes on this medication take it for life. Stopping metformin without an alternative medication in place is likely to result in poorer control of your blood sugars and put you at increased risk of long-term diabetic issues. Are there any side effects? Unfortunately, side effects when commencing metformin are common. Some individuals will experience in the first few weeks nausea, vomiting, stomachache and diarrhea, reduced appetite, and an unusual taste in the mouth, usually described as metallic. For the vast majority, these side effects will settle after 1 week. One technique to limit these side effects is to ensure that you take your medication alongside a meal. If these symptoms persist or are particularly troublesome, your doctor can switch you to a slow-release version of the metformin, which is usually better tolerated. Less common but concerning side effects can occur. If they do, please seek immediate medical assessment. Allergic reactions may present as the development of a skin rash or itching, swelling of the face, lips and mouth, or even difficulty breathing. There is a risk of developing lactic acidosis. Patients usually complain of a sensation of feeling generally unwell associated with severe tiredness, sleepiness, altered breathing or slow heart rate. Yellowing of your eyes or skin may suggest inflammation of your liver caused by the medication. Metformin may also limit the amount of vitamin B12 your body absorbs. If you become deficient in B12, you may experience tiredness, lethargy, pins and needles, muscle weakness, soreness of your mouth and tongue, and the development of mouth ulcers. Does metformin cause hypos? Fortunately, metformin on its own doesn't normally cause hypoglycemia. Hypoglycemia is where your blood sugar becomes too low and it can cause a risk to your life. However, many individuals may be taking other diabetic medications alongside their metformin, such as insulin injections or gliclazide, which can lower your blood sugar and put you at risk of hypos. Therefore, all patients should educate themselves on the early warning signs of low blood sugars. These include poor concentration, confusion and sweating, shaking or trembling, and the sensation of feeling hungry. If you experience these symptoms, eat a fast-acting carbohydrate to bump your blood sugars, such as fruit juice. To maintain your blood sugars for longer, consume something more starchy like a sandwich. I hope this video has supplied you with the answers you were looking for. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please do not ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.